Hello, my friends. This is Actor Sanjay Madhav. I'm going to record a video today on how I cured my low back pain that I suffered from for 35 years now and had surgery on it at the age of 19. I put together a document and I'm going to go through it because I have helped a lot of people um, just from sharing what I've done for myself because I've had multiple times in life. But, anyways, my back pain issue was definitely something where doctors just said, sorry, nothing we can do to help you. You're just going to have to live like a cripple, more or less. Paraphrasing. Had surgery, didn't help. Um, be cautious with that. Orthopedic surgeons won't tell you, but low back rate surgery success rate, statistically less than 30%. So, anyways, I had surgery, didn't help. Doctors couldn't help me. So guess what I have to do? Life has to go on, right? I have to work. I have to pay my bills. I have to put food on my table, feed my family, put a roof over my house, still pursue my careers and dreams, and so on and so forth. And so I was just trying to get on with the business of life. Here's what I did. Okay, I'm just going to tell you what I did. You take from it what you will. This is a holistic approach. It requires doing multiple things. Well, I did multiple things over a period of 2 to 3 months before I saw an improvement, and then saw an improvement, gained, and then became very hopeful, kept doing those same things for probably another 6 more months, and pretty much haven't had to do it since then. And I really haven't had back pain. Um, Certainly nothing of the degree that I have to even take medication for, like not even a Tylenol, not even ibuprofen, nothing. And I've cured it. That's what simple as that. So let's get into it. Here's what I did. Okay. And I'll repeat for the first 3 months, I did each of these 2 to 3 times every week. First thing, I invested in an inversion table. You can buy one for $100 from a Costco or an Amazon. Amazon will be cheaper. They'll actually deliver it to your home and set it up for an extra fee. So that's my recommendation. When you use it, start off slow. It's going to stretch the spine. You might hear a little bit of popping like you do at the chiropractor. It's all safe and good. Now, do a few minutes at a time, then every day or every other day, a few more minutes, because your spine has to stretch out. All those supporting ligaments, tendons, and tissues have to stretch out, and it doesn't happen overnight. And all those erectile spinal muscles and things that support and maintain low lumbar strength and core strength. So it takes time. But I noticed something really in about the first 3 weeks. Word of caution, when you do that, get up slowly from your inversion table. Your body is not used to being inverted and blood rushing to your head. So it's very typical that people will get up, even if you do it slowly, which I recommend, and then feeling a little kind of dizzy, lightheaded for a few seconds. But that has always passed. Second thing I would do is buy an e-stim, electrical stimulation machine. I use the one that is what's it called? Something 7,000. Anyways, it's like an Amazon Best Buy. It's $35 on Amazon today. I use it for 20 minutes every other day. I put the little pads on where it hurts. I run it for 20 minutes on different cycles every other day. Now, back in the day when I was 20 years old and I went to buy one of these, they were $400. Oh, by the way, that's called a TENS 7,000 digital TENS unit, $35 on Amazon, worth every penny. Third thing, you're going to have to do stretching. I'm not going to go into all the stretching, but if your problem is, if it's predominantly lumbar like mine, lots of information online. Look at pictures, research pictures for how to do stretching exercises specifically for the low back, hip, and glute stretching, because a lot of us have things like sciatica, we have pinched nerves in the backs, we have restless leg syndrome. I've cured all of this for myself. And do that for 10 to 15 minutes every night before bed. you'll have a total of maybe 6 stretching exercises. It's not as much or as inconvenient as you think. Maybe start off slow, maybe start off every other night. I find that if I do this these days, if I do this, 2 times a week before bed, or let's say I just come back from a flight, so sitting on a flight in a little piddly seat, waiting at the airport, or driving over speed bumps in my car, or whatever the case may be, you get you get these little irritations and flare ups and things like that. That happens. I do the stretching. That helps me sleep a lot. I don't have to take any sleeping medication to sleep. I mean, pills or anything, because I almost never have back pain that keeps me up during the wake because I get blood in there and circulation. Fourth thing, you have the rectus spinae muscles, low back on each side of the spine, whose function it is to support your spine and your posture and core strengthening and everything. I actually tore those muscles that could not be repaired on one side, could not be repaired through surgery. So I've done what I can with the remaining muscles on one side, and then I've gotten the other side as strong as I can. There's nothing I can't do today at 52 that I could do at 20. I can run, I can ski, and I scuba dive, and I do everything. Mind you, when I first injured my back, I was bedridden for a year and a half. I had to drop out of college, separate story, but that's how bad I was. Couldn't sit in the car or a chair in my classroom for 20 minutes without being in excruciating pain. Don't have that problem today. Haven't had it for 30 years. Um, how do you strengthen the erector spinae muscles? Look at your gym for 2 machines. One is either called a Roman chair or hyperextension machine. You want to use the hyperextension machine without having the visual aid. Basically, it's a thing like this, and you lie over, and then here's your head hanging and torso, and then here's your um, um, pelvic area and legs, and there's a bar here that supports it, and you just go up and down like this, up and down like this. It starts strengthening these muscles. Again, start slow. Those muscles might be very weak. Even if you can just do this 3 times, twice a week, that's a starting point. Eventually, you'll get to do it, maybe, barring any other um, trauma or scar tissue or nerve damage or something of that nature, you'll be in every other day. Just go 15 to 25 reps like that. To this day, do that twice a week. At the end of my workout, I spend 10 minutes and I do that. If your gym does not have that machine, look for the machine that's the low back machine that's seated. Okay, I'll turn. It's seated, and your feet are under a little thing that holds it. Your back is against a bar. You can adjust the weight, start lightweight, and all you do is you push back like this. Don't put your hands on your legs because you'll be assisting without knowing it. That doesn't help you. Cross your arms and do this. Push it back. Lightweight, push it back. Start with just 10 small repetitions, not even full range of motion, and work your way up. Okay? This is, you're going to note, I noticed results very quickly, but in 2 to 3 months, it was I regained a life. I regained a whole life because the year and a half I was bedridden, not didn't leave the house, gained lots of fat, went from being very active to no active, couldn't drive, could no social life, couldn't go out to eat, couldn't sit at a bar, couldn't interact with friends, nothing. But anyways, I've been through worse things in life than that. So I've gone through 4 things now, right? 5, massage. If you cannot afford to invest in professional massage, then here's a cheaper alternative. Go to Planet Fitness, buy the $25 membership, and use their hydro massage machine. It works pretty damn good. Do 10 to 20 minutes. The 10-minute sessions, when I do them 2 to 3 times a week. I go do 10 minutes. I come out to the front. I go, can I get another 10, please? They go, sure. I go back and I do 20 minutes, and I do that 2 to 3 times a week, more as needed. Kind of how's my back feeling that day, so on and so forth. And then, lastly, number 6 point here: walk with good posture to improve your circulation and joint mobility. Be active. Walk as much as you can. Walk. And with good posture, because that's going to help a lot with circulation, and it's just going to help you in many other health ways as well. Final thing I mentioned that's actually not on my list but just occurred to me: invest in a really, really good bed. I don't care if you have to spend $1,000. Buy the best mattress that you can afford. Me, as I prefer firm mattresses. It's just better for my back. I sleep better. I don't like all the plushy stuff. I get firm mattresses. That's part of your. This is part of your. This is part of your health too. Your back health and your overall health. Second thing, get really good, comfortable chairs for you. I have an ergonomic office chair that reclines. It has a lumbar support, it has neck support. I have a Chase sofa, which I actually sit most of my day on and do my work on with my laptop. It's amazingly comfortable. And oh, what is that now? Six, seven, eight? I even have a ninth thing. Things I'm just coming out with. I paid $50 for this electric heating pad from like CVS, worth every cent. I can put it on my back right now. I can adjust heat settings, low, medium, high, and so on. 10 minutes of that. Again, as needed if things act up. That's how I cured my back pain.